Welcome to Season 2, Episode 3 of Discussions with the Social Worker. Today we are discussing environmental health equity and maternal health with April Ellis. April graduated with her Master's of Public Health in Environmental Health from Emory University Rollins School of Public Health in May of 2020. Her primary research is on environmental health equity, specifically for minorities and people of low socioeconomic status. April is currently pursuing her Ph.D. at the University of South Florida. Please welcome April Ellis. Hey y'all, it's Sarah, the social worker. Thanks for joining me today. Today we are talking about health equity, or actually environmental health equity, with soon-to-be Dr. April Ellis. I'm so excited to have her today, and she's going to talk to us about the work that she's been doing and her research that she's been doing in Georgia and I guess in Florida as well, but we'll find out more about that later on today. April, thank you so much for being here with us today.
Awesome. Thank you so much for having me. I'm so excited to be here and talk to everyone. Just to give a little introduction, my name is April Ellis. I have my Master's of Public Health that I just received from Emory University, Rollins School of Public Health. So I'm excited to be done. I have my MPH, but I'm actually pursuing my PhD right now. I just started classes this week, so it's been, obviously everything is online, so it's getting adjusted with that, but it's an awesome experience. I'm excited to be in this world. Just more about me, I'm really into environmental health. My undergrad was in environmental science, and then I went into my master's degree in environmental health. Now, I'm very much focused on maternal health and health equity in the environmental health range. So I'm looking at lots of different things, especially when it comes to minorities and disproportionately like health equity. So I'm excited to tell you guys about my research and get more feel of so I can get y'all to understand how important it is that we continue to research this and change these aspects.
Well, first of all, congratulations on your graduation. Congratulations on entering your PhD program, all of which are amazing things. So let's get right into it. What is environmental health? Because when I think of the environment, I think of animals and trees, not necessarily people. So please tell me what this is.
Right. So most people think environmental health is just the good old outdoors, woods, plants, insects. Now, environmental health does focus on that. We look at a lot of bacterial diseases that get infected from flies, bugs, stuff like that. But environmental health has a whole different section, and it focuses more on the monitoring and mitigating of factors that the environment provides to us. So that doesn't just mean the outside walls, it means the people around us. What does our environment in our area that you are right now? That could be inside of your house, that could be people around you, that could be a hospital, that could be anywhere. We want to see what types of factors are infecting your health. Like, how is it affecting you personally? And so that's where maternal health kind of fits into our branch, our area of environmental health, which is where I'm focused on, because maternal health deals with the mitigating factors around the mother and how it can help her give birth before the birthing process, during the birthing process, and afterwards is where maternal environmental health affects each other.
Kind of going back to environmental health, and again, we're going to talk about your research, but you've kind of talked to me a little bit about it. So tell me, how does environmental health correlate with equity, like health equity, minorities, and individuals in a low socioeconomic status?
Right. So health inequities is basically the existence of the difference between health outcomes across different groups of people. So if you can understand, it's like the difference between a white woman's health equity, her health outcomes, and then a Black woman's health outcomes. Now, it doesn't have to be Black and white. It could be Black and Native American. It could be Asian and white. It could be Asian and Native American. It's just looking at multiple different health outcomes from multiple different groups, okay? So how does it relate to environmental health? We want to see how does the environment disproportionately or proportionally affect each group of people. Okay, so how does it affect Black people? How does it affect white people? How does it affect Asians? Just different, everyone across the board. Now, it gets more particular when it comes to minorities because we noticed, I mean, this is very much common sense, especially in this day and age, of how disproportionately affected minorities are compared to their white or non-Black counterparts. When it comes to where they live, the air that they're breathing, which is environmental health. We focus a lot on air pollution. So that's kind of where environmental health intersects with health inequities, and so that's kind of where I was talking about. It's kind of just a balance between the two, and how can we see what's going on and how can we fix it?
Awesome. Tell us, like, what is the definition of equity? Sometimes we use like equity and equality, and people kind of intermix them, but they are two different terms. And if you can just kind of explain what equity is.
Yeah, so the term between health equity is more focused on the wealth, power, and prestige of people, of the social determinants of health. So if you understand what health equity means, it's more or less just looking at across the different socioeconomic statuses, how does health affect those people, right? So we're looking at the upper class, the middle class, and the lower class. That is health equity. That's what we want to focus on, right? We want to see how is your health affected by what class you live in, what class you're in, okay? And so that's where we focus a lot. As in public health, we try to look at the lower class because those are the people that are most affected. They're the ones that don't get enough, funding for drugs, or they live in a lower side of the society where they don't get access to care equally, right? So they're on the quote unquote survival of the fittest status of either you make it or you don't, or if you don't have money, you don't survive, right? So that is the difference, and that's the definition of health equity.
Thank you. Okay, so the moment I've been waiting for, please tell me about the research that you were doing during your master's program and everything that you have discovered, what you are continuing to work on. I'm so excited to hear about this.
Yeah, I'm excited to tell you. So during my master's, I did a master's thesis, and I actually worked on a joint project with the CDC, the Centers for Disease Control and Prevention, and their environmental health branch, and also with EPA. So it was a joint project with Emory, EPA, and CDC. And so what we were looking at was we chose 4 different cities, 2 urban cities and 2 rural cities in Georgia, looking at their maternal health indicators. So how many hospitals were nearby this city? What types of birthing plans do people go to? Do they use doulas? Do they use birthing wives? Do they go straight to the hospital? And what's the difference between the two, right? Mapping out how many resources are available for mothers, and particularly across different races, right? In those areas. So my research led me to, we of course chose Atlanta, different cities in Atlanta as the 2 urban, and then we chose South Georgia. There were 2 cities in South Georgia that we looked at, and you can see the stark difference of available resources there. It's incredibly sad. One of the cities that we chose was Colesburt, Georgia. In Colesburt, the nearest hospital is an hour and a half away that does maternal health, that does any type of health related other than their county health center that just does basic level, doesn't do any high level testing. It's just, let me see your levels of blood pressure, like the basic level. So these mothers have to drive an hour and a half away to get to the nearest hospital to give birth in a safe environment and to see an OBGYN that can actually help them, right? Or if they get tested and their child has special needs or any type of anything, it doesn't have to be special needs. It could be they just have high levels of different chemical in them. They have to drive an hour and a half away, which is terrifying. And then we look at the stark difference here in Atlanta. Atlanta, the nearest hospital is 5 to 10 minutes away, and there's multiple hospitals, right? And so that's kind of what we looked at, and also the available resources they have. So we want to know, how are mothers giving birth, right? Well, it's hard if you go into labor to drive an hour and a half away. So I was like, okay, let's see where they're giving birth. A lot of people do home birth. Now, that's really hard to find information on because people don't really talk about it. So I was looking at doulas and midwives, and the hard, tragic aspect is there's not a lot. They have to drive. The doulas, they have to give them way in advance so they can drive out to their cities to come help them. And that's primarily what African American women in those rural areas would choose because they have to drive far away to even get to the nearest hospital. So it's kind of what my research was looking at. It was mapping it out to show CDC and EPA how they can work to fix this problem, right? We need to save these hospitals. South Georgia has a desperate problem where all these hospitals are closing. Just recently, another hospital that was the closest hospital to Colesburt just closed. So now they have to drive 2.5 hours away to Savannah, Georgia to get to a major hospital, which is absolutely awful. So that's kind of where my research is lying, is maternal health. And I really look at underrepresented minorities, so likely Black, Indian, non-white, and I also want to see the stark difference, right? Mm-hmm. How are they being treated? And so that's kind of where my research has led me to my thesis and my undergrad, and then I'm following that up in Florida. I'm using actually my research in maternal health here in Florida. My degree is kind of opposite of public health. It's marine science, but I'm using marine science as a segue into environmental health to see how mothers eat a lot of fish, right? I want to see what is it doing to their bodies, right? Certain amount of fish can be harmful, but what are these fish ingesting that's making it harmful for these mothers? So it's kind of a bridge between the two. So it's been great. And that's kind of a little bit about what I'm doing.
Wow. I don't know what else to say. That's so awesome. I think you've touched on a lot of issues that we as social workers who are like out there in the field, we're constantly saying there's a lack of transportation, there's a lack of healthcare, there's a lack of resources. And for somebody to be doing the actual research to find out where these gaps in services are, I think is so important. And for social workers to work with public health officials and other agencies to bridge these gaps is a conversation that needs to be happening more often. So thank you so much for sharing about that. What made you want to research maternal health? What sparked your interest?
So when I started my program, I was in environmental science. So I wanted to see what I could do in the public health realm because I wanted to see how this environment affects human health. And I actually had a Black professor, a Black woman as my professor, which was amazing. And she focused on maternal health. And she was really opened my eyes on how environmental health and maternal health segue to each other, because there's so many different factors that affects a mother, right? What is she eating? What is she breathing? What type of environment is she around, right? Does she have the right resources to help her baby thrive? Which is something that a lot of people don't understand, especially if you're not in the minority population, right? We just think you just go to the hospital and give birth. It's nothing hard. But Black women are 2 to 3 times more likely to die of childbirth, right? I give this talk to everyone. Serena Williams is a prime example to everyone. No matter how much money you have and how much resources you have, as a minority woman, especially as a Black woman, you can very much die because they don't believe you. She almost died giving birth, right? Because they did not understand her pain that she expressed multiple times. And that's a problem within our system, but it's also a problem that we can fix if we get proper training and not just assuming that we're lying about these issues. And so that's kind of where I wanted to get into, of why I wanted to research maternal health, is how can I help fix this problem? Because I want to be a mother one day, right? I have a couple more years or how many more years until I have kids, and I want to have a safe delivery. And I don't want to be scared to die on the table because some doctor doesn't believe me when I say that my stomach hurts and they're just, chalking it up to being normally pregnant. Like, that's not true. I know my body. So I think that this is very important. That's why I got into the field, is to see what can I do to actually make the change, right? We can talk about it, but what are we doing to change it?
So now that you're in marine science, correct?
Mm-hmm.
All right.
Yes.
So
Mm-hmm.
what's the next step with the research? Where do you go now?
Yeah, so where I am now is that I'm looking at the different lead and metal concentrations in the fish that a lot of people eat, especially a lot of mothers eat. I want to be able to see, okay, how much are they intaking, right? And how much are the fish actually absorbing into their body? Because that will entail how much mothers are eating and how we want to predict how much can potentially be in those mothers and what fish are more dangerous to eat than others, right? What should guidelines say that mothers not eat so that they're not endangering themselves and their babies, right? And also, where are these fish most commonly found, right? Is it Southeast Georgia? Is it South Florida? Is it in the Middle East where, it all depends on where you are as a mom, right? So I want to be able to look and say, hey, these certain type of fish in a certain area, you should steer away and maybe try a different fish, go to somewhere else. So that no matter where you are in the world, right, I want to be able to affect mothers and have a positive impact on them. So that's kind of where my research is now and my dissertation will be on.
That's so exciting. I'm looking forward to reading your published work. Is the work that you did with the CDC and the EPA, is it published as well, or is it still like a work in progress with them?
Yeah, so they're still working on it. They're hopefully going to be publishing it in the next year, so that's hopeful. Everything in CDC and EPA obviously is pretty slow process, but I'm excited I'll be on the paper, which is something awesome. And I think it'll be pretty cool to see. And hopefully when it comes out, I will be spreading it everywhere so that people can understand, especially as social workers. We work so much with social workers in public health. And I feel like that's so essential because we need that, right? We need to all be, especially in the health field, we can only make change if all of us are on the same page, right? We often get so disconnected with one person is right versus another person is right, their theory, and it's like, no, we just need to be able to coexist together and understand each other's aspects,
Most definitely. And I can't wait to read it. And I mean, anytime anybody gets published, that's like such a big thing. So congratulations on that.
Thank you.
But before I let you go, I have a couple more questions. One being, what can we do, people who are watching this today or other clinicians, social workers, people in helping professions, what can we do to help make health resources more accessible to moms in rural communities, moms in impoverished communities? What can we do?
Right. So the best way to do it is to just not assume that it's there, right? You need to get out into these areas that you think, oh, okay, like we have a hospital here. I'm sure that everyone in this area can get to this hospital, right? That's something that needs to be taken away, right? And you need to get out into the communities and walk to these places that have low economic status, right? And say, hey, like put up posters or go door to door and say, hey, did you know that this area, this hospital or this clinic is right here? And really, a lot of clinics are very essential, not just hospitals. We want to look at clinics. We want people to be more open, right? As social workers, we want people to, I feel like you guys talk more about like getting out there and having these conversations with people. Having and talking to mothers is so important because their mental health affects their baby's health. And so many times these mothers don't have any type of resources available to them, which is why they create this cycle, right? Having kids young, not being able to afford the kids, then their kids don't have one or two parents, then their kids have kids young, right? It's just a cycle. So if we're just talking to them and being there and available, especially during the birthing process when they are pregnant and afterwards, right? Postpartum depression, it's a huge deal. A lot of mothers don't survive postpartum because it's such an emotional time afterwards, and you want to be able to be there for them, right? So I think that's very much important in the health field. Whether you're, especially doctors out there, please, please, please listen to your patients, because your patients matter, right? If they're telling you something is wrong, right? Don't just assume it's normal pregnancy hormones or pregnancy tendencies. You need to check up on it. You need to do everything possible, whether that's going to be multiple tests multiple times that keep coming out negative. That's fine. We'd rather you do that and keep getting a negative than don't do it and she's bleeding out and she dies, which is still happening to this day in minority women. So I think that's how everyone can best be available. Just be open, honest, talk, have those tough conversations, and be there. Especially for pregnant women, they're going through so much, and afterwards, they need all of the help and all just to realize that they're not alone, right? And that someone cares.
Yeah, definitely. Thank you so much. I feel like I've just learned so much in the few minutes that we've been talking, and I hope that when people walk away from this conversation, they're also as equally fired up about maternal health, because like you said earlier, it's like a few years away for me, and some people it might not even be in their mind, but at some point in time we all come across somebody who's a mother, and so we should all care about this. Oh, thank you so much.
Right.
So my last two questions, and I always ask everybody this before we leave: what is one thing that you took away from today, and what is one thing, if nothing else, that you want others to take away from today?
Yeah, so one thing I took away from today is that I love the fact that that you created this channel, and especially that a lot of social workers and people in the health environment are willing to listen and understand different perspectives and also just different jobs and what people are doing. And I love that. It's very important to open your horizons. I love to learn about what people are doing, because I might want to get involved, right? We want to be able to connect. Connecting is everything right now, especially in this day and age. Now we're home, we're stuck in the house. This is the perfect way to talk to people. And the one thing that I want people to get from this session is that environmental health is extremely important, especially maternal health. It's something that doesn't get noticed often unless you are a mother, right? Or an expecting mother. But it's so important because your mom gave birth to you. We're all humans. We all came from a woman or from some side, we all came from somebody growing inside of us. So I think it's important for other people to understand that even if you're not a minority person, this isn't just saying that white people are just going to have an easy birth. No, they have a lot of issues themselves as well. It's just health equity, right? You can be a white woman and be in South Georgia and rural area, and you're still traveling 2.5 hours, right? You're still put in danger. You could be giving birth on the side of the road. So I think that this is so important for everybody, no matter the race, color, whatever religion. It needs to be talked about. And I hope that this got everyone excited to get more involved and to learn more and do research or just Google and see how you can help.
Yes, thank you so much. April, is it okay with you if I link to your social media account if people have questions they can ask you? Okay, awesome. So yes, anybody who's watching, in the description section below, I'll make sure to have April's social media there. Feel free to reach out to her. She's very knowledgeable and very passionate, and I hope that we can all find our passion in life like she has. Thank you so much for being with us, April. And remember, maternal health and environmental health are extremely important. And please educate yourself on these topics and have a conversation with someone. Thank you, guys.
Bye, thanks, guys.
Thank you for supporting Discussions with the Social Worker. To stay connected and current with our content, follow us on social media and subscribe to our YouTube channel. Thanks, y'all.